I'm here today talking with Carol Harnett about important workforce issues. Carol is a highly respected, recognized consultant, speaker, author, and I love trend spotter in the human resources space, focusing on employee benefits, health, productivity, management, and performance innovation and values-based health. Her insights and expertise help businesses support a thriving workforce. I have been a follower of Carol's for many years. Carol is also the president of the Council for Disability Awareness, a nonprofit that focuses on research and education around the importance of a financial safety net when people need to leave the workplace because of a disability. Carol, it's great to be speaking with you today.
Oh, it's so great to be here with you, Cynthia. It's always fun to be with you.
Great, thank you. Yes, it's been a while, but I'm glad we're back together.
Yeah.
So, Carol, there's been a lot of talk about the impact of COVID-19 on people's mental health. But even before the pandemic, as you and I have discussed, mental health was an issue. How would you characterize the current state of mental health in the workplace now?
You know, that's a great question. And if you don't mind, I think we should start with a baseline. What was the prevalence of mental health challenges pre-pandemic? And the single best source for me, which I never see cited, is something that's called the Dunedin Study. And Dunedin is in New Zealand. It is a community of originally 1,037 babies who were born between April 1st, 1972 and March 31st, 1973 at a specific hospital. And they've been followed for almost 50 years. And Duke University has been from a distance involved in this research, specifically from mental health. And they found, as they worked through all of these years of data, and not every year was data collected around mental health, it was only most years, that in that almost 50-year span, over 80% of people had at least one incident of a mental health challenge. And they believe, because they didn't sample them every year, that it's probably over 90%. So it is actually more normal to have had a mental health challenge than it is not in a lifetime. So that's our baseline. Now you layer in a once in a century event. And what we see from another survey that's done in the United States by the federal government is called the Household Pulse Survey. And that I actually happened to be called to do the survey the first time they were doing it post-COVID, April of 2020. And every week you answer some simple questions. And what we found was, at least currently now, 35% of people of working age between 18 and 64 years old are reporting anxiety or depression. Compare that to January and June of 2019, it was an 11% baseline. So we are in an extraordinary time around mental health.
Great. Thanks for that. That interesting statistics, unfortunately trending in the wrong direction, but we know it's important. And I think the other thing that you and I have talked about is mental health is something we need to be aware of on a consistent basis. And it needs to be front and center for all employers now and going forward. So thanks for that great insight, Carol.
You're welcome.